Good afternoon. Thanks for coming today. I'm Penny Leupold. I am a nurse. I am a certified healing touch practitioner. I am working on my certification in aromatherapy. I do other holistic type of care. And soon I will be joining holistic health care centers to start doing healing touch, aromatherapy, Korean hand therapy, different things that I do. I have my own practice in Plainfield, and that's pretty much, I'm retired after 31 years of teaching nursing, and I've been a nurse for 41 years. So today, what I'd like to talk to you about is essential oils and aromatherapy. There seems to be a lot of information out there. We see them around, but I want to be specific about essential oils with the healthcare and the holistic as far as treatment. What are essential oils and what are their health benefits? Who all uses? Anybody use essential oils? Have much?
Yes.
You do? Okay, so good. Chime in anything that you would like to of information. First, we're going to talk about what are essential oils and where do they come from. Essential oils are the life force, the essence of a plant. That's where they come from. We get them from plants, from herbs, from trees, anything that is basically growing, even some grasses. Essential oils have been being used for over 6,000 years. The ancients come along. We have back, they believe that they've seen them on the carvings on walls even, because they will show the plants and then the oils with them. They go in the Bible. There are so many references in the Old Testament. The Egyptians, the Chinese, everyone has used them. Lots of research on them in France that has been around for a very long time. Essential oils have really come into play more in the United States since the 1980s, as kind of the holistic movement really has come forward. You hear the word aromatherapy, and everybody thinks, I think essential oils when I hear that. Aromatherapy is just a part of essential oil. All oils have an aroma to them. And that's where the aromatherapy comes. It is not just, I walk into a house and I smell chocolate chip cookies. That is a wonderful aromatherapy. If you come into my house in the wintertime, you're going to smell cinnamon and oranges and spices. That is the aroma that I just love in winter. In the summer, you're going to smell orange, but not the spicy. Is that aromatherapy? Absolutely. It speaks to me. It may drive somebody else crazy, not liking it. Essential oils, and what we're going to talk about are therapeutic essential oils. And the therapeutic grade, they all have an aroma which affects us, but we use them in other ways. So on your handout, it talks about aromatherapy in just a little bit, but no, they all have an aroma, and that's the only part that is that part of therapy. But we use them, we apply them. Some will say you can ingest them, but only under the supervision of someone trained, understanding the oils. Now there's different grades of essential oils. They're primarily extracted through steam distilling, also through cold pressing. It's a whole process that they go through, and then they take the different top layers. The better oils always are the cold press or the steam, and they've taken the layers, not the ones that start sinking down. The purest essential oils are the most powerful, the most effective. They deliver quick and effective treatments depending on what you're using. There are certain standards, ISO standards, we hear the International Standard Organization. There are French standards, there are English standards, and we are working on standards here in the United States also. And to be a therapeutic grade, a high-level therapeutic grade, they do meet these standards. Also coming from essential oils is a vibration. The vibration levels of the oil is tested. We were just talking before we started about the different fields and the different crops that are raised specifically for essential oils. And they have to meet these different, if something is supposed to be at a vibration of 90, when they test a batch that they've done, if this vibration and it's 90 megahertz, if it's not, then it probably is going to be sold at a supermarket or one of our stores that we buy essential oils at that are not therapeutic grade. Anytime you hold a bottle, and I brought some essential oils, just different ones, you hold that bottle, it is a pure essence of that plant, of the oil. When you have pure therapeutic grade oils, these are straight oil, not cut, they're what we call neat. There is not other oil mixed in with them. They are the true essence of that plant. They can be applied topically. Massage therapists use it. I use it, just when I've got aches or something. I'm not a massage therapist, but I can put it on. You can apply it topically and smell it through your hands. We're going to do a little bit of this. You can inhale it. You can diffuse it. You can put it steam, what we call steam inhalation, vaporizers type of thing, or cold, through the house. When you're looking to purchase essential oils, one, you should always consult with someone who understands essential oils, or do the research to know, to make sure that it is okay to have the essential oil. If you have health conditions, different things, or some oils that you should not take. If you're on blood thinners, you should not be using cinnamon essential oil. There's some cancer. Some of the essential oils are estrogen producing, and depending on some people with cancers that are estrogen cancers, that we certainly wouldn't want them to be using that. So it's always good under the practitioner that knows. When you want to purchase some, if you're looking, if you don't know where your source, go on the internet, call, find out, are these tested? Are they cold pressed? Are they, steamed? And what's your ratings for them? Because what we buy at the supermarket, we buy it, not to plug somewhere, but I use a lot of Bath and Body type of oils and stuff because they do smell nice. But they are not the therapeutic for a health benefit or treatment. They're a pleasurable. They're the chocolate chip cookie smells, type of thing. And they're just fine, but they're not for when I'm treating you as a practitioner type of thing. As it says, some change in how the body reacts to them. They do evoke hormones. They evoke enzymes, and so that's why it's always to have the right one. Some of the high quality producers, and I'm a couple that I like to use, but there's others, they are few and far between for the high levels. Young Living Oils is probably maybe one that you've heard. You'll see them, if you look, they have a wonderful website to even learn from, even if you don't want to buy any oils, but to learn. Eden Garden is another one of high level. Those are probably the two that I like to buy from to use. So how do essential oils work to provide health benefits? Number one, we are all energetic beings. Remember I said the oils have a vibration? They have an energy to them. We are energy. Our bodies are the solid mass of energy. Our energy fields extend far beyond how far I can reach with my hands. We have a physical level, we have an emotional level, we have a mental level of energy, and a spiritual level. And then it repeats itself going out into the universe. Okay, so the oils, one can relate to that. We use them as far as with our vibration. I don't know why I have some. It's just like I have a bite or something. I'm so sorry. They promote physical, mental, emotional, spiritual healings of our body, depending on what oil you're using, what kind of treatment. When we inhale essential oils, it goes from our nose down into our lungs. From our lungs, it goes out to our bloodstream to our bodies, depending on what we're looking for. That can result in a chemical, physical change within whatever we're using it for the treatment. It affects our hormones, our enzymes. Essential oils can affect our mind and our emotions. The fragrance of that of an aroma, or whatever you want to call it, fragrance, aroma, of essential oil travels by way of the olfactory nerve, which is your nose, your breathing, goes goes to the limbic center in your brain. Limbic center is kind of right in the center of your brain, and it's where the hippocampus and the amygdala, it hangs out. And this is where the seat of your emotions, your memories of both positive and negative emotions stay. It is the only way that we can reach that center of your brain to be uplifting, to help release, for whatever it is, for the reason you need it, is through sense of smell. And that's a scientific fact as far as for helping release that. And that's why somebody who loves chocolate chip cookies takes them back to mom baking in the, that's a long. Or I might smell some, like a cigar, and I have a negative, reaction to it. But this is the part, the limbic system. And everything is stored, the emotions, almost trapped until they can be released. We respond also to the frequency, the vibration, the energy, whatever word you like to say of the essential oils. It is not just chemistry and the aroma of essential oils, it's also that vibration. Our bodies, when it's in balance and in health, are between 62 and 68 megahertz as far as with the vibration. This is what they consider to be equilibrium when we're in nice health. We have a little variance. When we drop below 62 megahertz, we consider that we're working probably into illness. That has probably happened out in our energy fields long before it hits our solid energy. The vibration of the essential oils help, depending on what you're looking at, help bring you back into normal vibration. I have some references if you want to look at it to see where, some of them are like way up high, some of them are right even with us. Depends. Okay, so health or therapeutic benefits of essential oils. Number one, I need to say, I feel like I need to do my disclosure, but it's very important that when you use therapeutic grade essential oils, you should be under the trained guidance of a professional that understands essential oils. Okay. So depending on which oil, you might experience sedation, you might experience relaxation, you might experience, I'm just hyper a little bit, or euphoric type feelings. Just depends on which one you use and what you're looking for, the reason that you're using them. Respiratory issues, blood pressure issues, but they all are specific and they have their properties for what they're going to be used for. I mentioned that you probably wouldn't use cinnamon, which, my favorite thing, but when you're taking it, and you're on blood thinners or you have something, there's a lot of conditions you would never touch cinnamon. Sprinkling a little cinnamon on the pancakes is one thing. Taking this, because this is such an extreme concentration, can greatly affect you. When there are emotional issues or painful memories that are stuck back in the limbic center, that essential oils help open that door so it can be dealt with, released. I use essential oils with my healing touch, which works in the energy fields. And if that's what we're doing, sometimes I will just get a client has a huge release, and that essential oil helped it out, and then, it's out there, so long, what's our next step to deal with it? Let's see. Depending on which oil you use, prescribed, depending on what state you're in, some are actually prescribed, some are recommended. I would recommend to you because I don't prescribe here in Illinois. But the benefit, some are antiviral, antibiotic, anti-diabetic. They help with pain, help with discomfort. The list goes on and on. Antiseptic, tea tree. It's like sometimes I just live with tea tree, oregano. Now again, therapeutic grades help with flu, immune systems. Y'all probably have heard of lavender for sleep, and when you use a therapeutic grade of lavender, I will give you a little example. I had a family member that had brain surgery, and after brain surgery, They told us there's going to be a lot of disorientation and those kind of things. Well, all of a sudden it hit, and I'm watching this person be totally disoriented, confused, and I thought I had brought my essential oils with me, and I put the lavender so that this person got 3 good breaths of it, sniffs of it, and I just watched this person calm down and just relax and fell asleep. And, I left it there at the hospital for the nurses to use, and they, kind of, as it started, the agitation started up, and it, made me a true believer. I mean, I knew that I liked it, but that made me a true believer. The list goes on, and I can give you lots of other information if you would like some. So, ways that we use the essential oils, I kind of mentioned, we diffuse it. Diffusers can be fancy, you can spend a lot of money on it. I have a little travel one that's about this big that takes 2 AA batteries, got a little fan on it, and I put on a piece of cotton my oil, and it sends it out to the room. It's my favorite diffuser. I have the $150 one that sits back in a corner because it's just too much trouble. The steam, we inhale it. You're all going to give a try today. You apply it directly onto the skin, and some can go on neat. Others are too strong to go on the skin without mixing with an oil. And I have just like a little sesame oil. Sometimes I use my EVOO. That's what I have. Massage it. You can use it. Personal cleansing. I can show you. I use Thieves, which is a number of essential oils for an antibacterial. It doesn't have all the other stuff in it. And it's it's like 98% killing bacteria for the studies. Use it for cooking, use it for cleaning. So essential oils can come along, many different avenues. So we use it in holistic treatments. We use it in subtle energies, which is healing touch. You've heard healing touch, Reiki. Use it when you do color therapies. Acupuncture. Anytime you combine these different treatments with essential oils, it's a synergistic effect, and it's a dynamic duo together. Again, working on the different physical, emotional, mental, spiritual levels, depending on what you need. You might just be pain, you might have an emotion, you might need that I just need a time out and something that will help me relax. As I said, not all of them are safe for everyone because of the chemical structures, things that we consider our age. The young and the elderly are very sensitive, and they are ones that do not belong. Some oils just would never touch a child with, or an elderly person, because of the effects that it would have on them. We have to look at the state of health as to illness. Certain ones are not good for asthma, certain ones are wonderful for asthma. Whether there's cancer, diabetes, blood thinners, just to name a few of them. What type the illness is, depends on what we would use. Pregnancy is another one. Certain ones we never, peppermint never on a pregnant lady until they're in labor, until they're in active labor. And then peppermint is our best friend, mixing it with it. I wrote out on the list, we use it antiseptic, and I kind of just listed a few. The antiseptic, antibacterial, lemon, tea tree, cinnamon, oregano. A lot of times when you're sick, you feel a cold coming on, those that use essential oils, the oregano, the lemon, the tea tree. They have done some wonderful studies with tea tree and with cinnamon, oregano, and I believe it's thyme, working on MRSA. I don't know if you know what MRSA is. It's totally resistant to antibiotics, 98% effective. They've done studies where they've got MRSA all the way to the bone. Within 3 months, it is totally gone using this combination of 4 essential oils. Again, therapeutic grade. The research is out there. Mayo's, University of Maryland, certainly Young Living does lots. Different studies are going on. We're really paying attention to them because a lot of antibiotics and things don't work where this does. Diffuse lemon in your air, in your house, kills off I got the actual number, but it's a 90% of bacteria that's just in the air, like in your room. Which kind of an easy way. And you'll smell clean. You'll know that somebody used cleaner, or at least it's a good disguise. Antispasmodics, aid in digestion, blood pressure, detoxifying. One that's not on your sheet there, a couple sexual function, yin yang, yeah, I don't say it right, yin and yang. It's a nice one. Everyone likes to know about that one. There's some for meditation, opening up to higher consciousness. You know, there's just, they go on and on. There are blends of essential oils that you know, I may have lemon and I may have oregano, but you put them together and it does a whole nother set of, you know, work. So let's do, any questions at this point? Let's do some fun things. I want you to just, we're going to do a little aromatherapy part right now. And I'll save the lavender till last because it will just be interesting. We'll go with peppermint because it's warm in here. I want you to smell it first. Again, I'm a pepper. Kind of just do a couple good breaths and then pass it on. So, what do you smell? Anything that it stirs, feels, other than make you hungry, maybe?
Yeah.
Anything come to mind as you're smelling peppermint?
Belongs in a chocolate drink in the middle of winter.
That's coming now. You went through your olfactory, brought up some of those things. But that peppermint works really well, like if you're nauseated. Again, pregnant is not one, but you know, I'll put some peppermint, like if there's somebody, or I'm just not feeling good, I just do a little. I have to tell you, it's under direction. You know, only certain ones can be ingested. But I put just a couple. I put a little drop of my finger on the end of my tongue when I have indigestion, and pretty soon I have a huge burp, and I'm like, oh, it's just gone. It amazes me. But I'll put it in like a little bowl, kind of diffuse, put it by an air vent, and the peppermint smell if someone's nauseated. It works wonders and helps with digestion. This is cinnamon, and just smelling it, even if you're on blood thinners, is okay. Just don't drink my bottle. See how this smells to you. And sit with it just as it goes through. And some that I expect to smell just wonderful aren't the smell, but it's the properties. No one is I can't want to say no one. Rarely is anyone allergic to essential oils because the pure essential oils. And if you have a question, you can always do the little skin test, just like, you know, and I would do that always just to be sure. But because it is in the pure state, there aren't all the other chemicals and the additives. Would this anything?
It was more earthy than I thought it would be.
Are you expecting a cinnamon stick?
Yeah.
Yeah, I know. I was very disappointed.
Yeah.
When I told you, my whole house smells like cinnamon, but not this one.
Not that one. Bath and Body Works.
Yes. Yeah. Anything else come up? Here, clove is a wonderful essential oil. Clove themselves. Clove, if you've gone to the dentist, and sometimes if you're going to get a shot, they'll kind of clean the area and it tastes like clove. It is one of the best antiseptics. And we'll all be ready for spiced wine after these smells. If you'll notice, these are my winter smells, but they are ones that just... Yeah, it smells more like clove.
Yeah, that's very...
But it's like if you get a cut, you know, not on an actual open, but just to dab or to clean an area. Anything?
Makes me think of ham, because you always put cloves on ham.
You know, I'll be going out to eat after
Yeah.
we're done here too.
Yeah.
Now here's our, did we do lemon? We didn't.
No.
Okay, lemon. And lemon is your friend. Probably if you're looking to get one, lemon is a great one because it can be antiseptic. It's the one to diffuse. You know, I have on my kitchen counter lemon, lavender, and peppermint. They're like my best friends. There are other ones, but they're the ones kind of like the go-to easy ones. I just needed my smell. If you were doing this as a treatment, but I don't want to get you guys out, you would have someone inhale deeply and you do it 3 times. Everything's always in 3s. You know, like that, long breathe, then do it again, and then do it again. You know, or doing for yourself.
Does lemon help with nausea at all? Because I know in Chinese medicine it helps with, we prescribe to women who are pregnant to suck on a lemon. Is that
Right, it can.
Okay.
And again,
I understand. Okay.
right, that's, now this one, after you go out and have your nice meal, this is yin yang, how do you say it?
Yin yang.
Yin yang. This is the one that will help your sexual functions. So make sure you get a good meal tonight.
I haven't stayed away from medicine.
But unfortunately, I'm not crazy about the smell. Oh, smell it again, Jordis.
Yeah.
You're the only one with a partner here.
Oh wow.
Oh yeah, no.
No, but when it's diffused, it's a different.
It's a, yeah.
Oh no.
To me, it's not a big
That's not a winner to me.
That's it.
Get back to me, everyone, after. Okay, now we're going to do, so you've smelled that. I'm saving lavender for last, one, because it is relaxing, but we're going to do a little experiment, too. We're going to do a couple things. Smell this one. Oh, I smell it from here. And pay attention to the smell. One of the things that I cannot find is if you have no sense of smell, which some people have damaged or whatever, whether it still goes back and affects, even though you cannot sense it, if it's, okay. So you got this smell, this aroma. And see if you smell anything different.
Yeah, I did.
It should be similar. Let's see if you...
See if that was truer.
Yeah, but the other one smelled like a little bit of lavender.
Which one? Thoughts? Which
The
one?
first one to me was grassy. It was a
Okay.
lot grassier. Like notes of like alfalfa. Like,
It's a good nose then.
well,
I'm
I used
into
to.
earth today. Did you notice a difference in the smell?
That one smelled better, but I still can't place what it is.
This is a pure essential oil, and sometimes the pure ones are not the most pleasing. Because remember, we're conditioned to, you know, and I'm not knocking those. These are the therapeutic ones, and the others are the pleasure ones. This is lavender. This is also lavender. This is Lavender grosso. This is lavender something else. I can't read it, but this is what's growing like here, like in Washington and that. Beautiful lavender. And it just says 100% pure essential oil. It is not therapeutic grade. And what happens with Lavender grossa is just a type of different lavenders. It's not, it converts into camphor as it goes into our body. And it changes, and so the effect that maybe I'm having, that I am going to sing you a lullaby and you'll be asleep, if we're looking for that, will not happen with this. It'll happen, but a lot more of it, and a lot where 1 or 2 drops of this may put you just, this is the one I told you about, the patient that just a couple breaths, and so dynamic of what it can do. So I'm going to leave you with, so that is how, that's different type of inhalation. You can diffuse it, you can, you know, smell it. So let's do a little topical. Put your hands out. And if you'd like, I was going to do lavender.
I don't like it.
You don't like it?
No.
Because why? Good, why? No, I don't want.
Yeah, you can.
That's
but
okay. You can have any one you want. Why don't you like it?
Both lavenders will give me a headache.
Okay.
They already are starting.
Are they both of
Yeah,
them?
yeah.
That one for sure. I would.
Yeah.
Would you like?
I'll go back to lemon.
Okay. You want lemon? What would you like? I'm sorry. I told you this is my go-to one. So, we're gonna one to leave you with on your hand. What would you like a smell? I should do it that way.
Cinnamon. Cinnamon.
And this is cinnamon bark. There's cinnamon something else, but cinnamon bark is the one that can use more with different. Who else? What would you like?
I'm okay with lavender.
Yeah.
And Gary, you wanted lemon. Okay. So now, what I want. What? I know, a good shot of. I'm going to give you 1 or 2 drops. Ideally is 1, but usually comes
Just
out
1,
2.
yeah.
And I want you to take your hand on your palms 3 times in a clockwise. And that's, everything's in threes. And then bring it up and just do some nice deep breathing with it. And again, away and do it 3 times. And see, pay attention to how you're feeling right now, thinking whatever. See if it does anything. And I'm not saying it has to or will, but a lot of times it does. Okay, see, no matter what, it's almost
Yeah.
out. It's not an oil, it's not a hand wash.
He's just
You
going.
wanted cinnamon, right?
Yeah.
Diffusing.
That's fine.
You're the answer.
It said 3,
Yes.
and then you.
Oh, I smell that. Wow.
Mm-hmm.
This is lavender.
Mm-hmm.
Lavender, can you read what it says?
Oh my
That
gosh,
contact
my eyes
center.
are like yours. It just says lavender.
Yeah.
100% pure therapeutic grade essential oil supplement.
Okay, I have it in my book probably, but the lavender grossa is the one that unfortunately converts a little differently. Oh, you got it. Yes. We'll wheel you out.
Yeah.
And just take your time. Could have used peppermint for you for your bronchitis.
That's true.
So does it smell any different than when you did it that way?
I think it smells better when you do it this way. You get more of the aroma.
You really get the aroma. I have all of them on me right now.
Yeah.
It's my kitchen. Now you're coughing. Did it bring that up, or is that your cough?
It's my cough.
Okay. It would probably cough either way. Okay. Gary, how about the lemon?
It's good. Straight from the bottle is more intense.
Right.
I don't know whether that's good or bad. It just
Yeah.
is.
It is, and this is more tolerable.
More lingering, perhaps.
Mm-hmm.
Yeah.
And yeah. And what
That's
you're
how I
doing.
do it.
Yeah.
Now, what I'd like you to do is another way to use is just you can bring it up or just kind of take it down through your field, your energy field. When I use it, when I do energy work, I kind of ask and figure out which is the correct one to be using, and then I put it on my hand. You would smell it, and I would probably put it on the soles of your feet, depending on what, because your soles of your feet are also, major port to your body, and it just, it clears whatever. It just they work together. How about you guys with the lavender? Do you see a difference?
I use lavender a lot at home with my kids, especially when they're very rambunctious. So I do that at nighttime. I do a lot of that.
Roman chamomile is
Yes.
great with kids also.
So I love it. And I used to wear it all the time. In Chinese medicine, we used to think of it as more of a clearing thing. So when we had bad patients, we'd put on some lavender, kind of clear the air after a patient left.
And another one that's really good for clearing after a patient or clearing and clearing yourself or whatever, but certainly after, is sage.
Sage, okay, that's another lavender.
I don't think I brought sage. I was going to, and then I just didn't. But sage is an excellent one that you could just take through your field. I just take it and kind of spread it in the room also. Diffuse.
Yeah.
Well, it just breaks up energies also. It's that goes back to our Native Americans. Goes way back to the Chinese, but our Native Americans always burn sage, You know, and you would sage, if you're in ceremony, it's sage. And that clears the energy, takes away if they, questions, comments, anything?
Good presentation.
Thank you.
Once I got my act together.
No, but it's very interesting information.
Mm-hmm. It, you know, essential oils, a lot of people will just say, oh, I've got aromatherapy. Well, really? You know, and anything can be aromatherapy. You know, whatever is a good smell to you, or a negative smell. I mean, it triggers both. Again, your limbic, your amygdala is right back there that remembers in your hippocampus, different parts of it. Yeah, that's where we're just talking now. They store, and that just brings it as well as